Thanks for staying with us. So recently, many states eased lockdown caused by the coronavirus. They reopened churches, mosques, and sometimes nightclubs. I think, YK, you've been allowed to open, right, since last week?
Yes.
Right.
No, not the club, just the bar.
Just the bar, right. So the system is gradually returning to normal. However, many are wondering if the ease was necessary, as the number is still not declined. In some cases, it's still rising. Joining us on the show is the National Coordinator, Presidential Task Force on COVID-19, Dr. Sani Aliyu. Good morning, sir.
Good morning.
Good to have you on the show this morning. So,
thank you. Pleasure to be here.
Let's talk about the ease of lockdown so far. I mean, across the country, we've seen life return back to normal gradually. Schools, SS3 pupils are writing the exams. Churches have reopened. Some places of work have actually opened fully. In your view, what has been how have you been able to review the ease so far? How has it been nationally? What kind of reports have you gotten so far from all the various states as regards how people have either complied or not complied with all the various guidelines provided?
Well, first of all, to start off, we haven't really eased completely when you think of it. The schools have only partially opened just for the purpose of exams, which is just for a few weeks, after which they will be closed again. A lot of the aspects of our day-to-day work is not back to normal. So, for instance, we still have a curfew 10 p.m. to 4 a.m., even though some may not necessarily observe it, but nevertheless, it's still there. I think what's important is for us to continue to make sure that those non-pharmaceutical interventions we talk about, so the wearing of face masks and physical distancing, hand hygiene, good respiratory etiquette, etc., are seriously complied with. Because if all of us continue to do those measures, there is absolutely no reason why we can't continue opening up. Because this is a respiratory viral infection. We know how it transmits. We know how it goes from one person to another. We are, at the PTF, we continue to be quite concerned with the degree of compliance to non-pharmaceutical interventions. In fact, we are reaching out now to the state governors to continue to emphasize the need for effective community engagement and mobilization right down to the grassroots level to make sure people are aware that this risk is still there. As you said quite correctly, COVID hasn't gone away, far from it. One of the reasons why our positivity rates are sort of coming down, the number of positive cases we're getting is slowly coming down. It's most likely because of the level of testing. We're still not testing enough. We are still testing quite a small percentage of the population. But we do have other strategies, including concentrating on what we call hotspot local governments. We've now expanded the number of hotspot local governments to 20. And this is across about 8 or 9 states. Right. And we will continue to emphasize and prioritize these local governments and make sure that a lot of testing is being done. Right. People that are positive are being identified and isolated.
Okay.
Yeah. You had said a few months ago that by July you hope to have conducted 2 million tests. And as at today, it's only 350,000 tests. What has gone wrong? What can you do to increase the tests so that we really know what our status is in Nigeria?
So you're definitely right. So the responsibility for testing is primarily that of sample collection is the key part, and sample collection is primarily the role of state governments. At the moment, we have expanded working through NCDC. NCDC has the primary responsibility when it comes to surveillance and testing. We coordinate them. But when we talk about testing and laboratory capacity, we've increased the number of labs to 64. At the moment, we are doing about 3,500 tests on average every day. But our capacity is 10,000. And one of the key reasons why we are not testing enough is because of the very low demand at the moment. People are just not coming out to test at all. When we go to, one of the reasons why we get to the 3,500 is because we have to actively go out and seek out people for testing. So I think When it comes to testing, it's really a joint responsibility between both the federal and the state governments. Yesterday at the press briefing, I did mention that we will be reaching out to the state governments because we've recently given them funds to enable them have better surveillance. Part of those funds are supposed to be used to open up sample collection centers across the local governments, particularly in facilities that we call high throughput facilities where they have a lot of patients, so that we can have improved access. Because we know not only are people not coming out to test, but sometimes they have difficulty in accessing testing. Whereas if you bring the sample collection sites right down to their villages, to their local governments, it should be easier for people to test.
Exactly.
But it's only by testing widely that we would know the extent of the problem and be confident that when we relax some of these restrictive measures, things will continue to be safe.
Dr. Sani, I wanted to go at you when you said that, you're willing to test, but people are willing to show up. But you got to the point and said, for some people, it is an Herculean task to get to get those tests done. Because I went through rigors to get my test or retest done twice. And I know what it costs. The crowd of people in Lagos they were not even able to cover them. So I would ask that you have a strategy. For instance, in the local governments that are high risk that you mentioned that you have increased now, what exactly is the plan to get people in those areas that that since you can highlight certain local governments as those places where they have very high number of spread? What are you doing to increase tests in those particular areas such that people don't have to go on the website, wait for days to get tested and even spread and die before their tests are done?
There is absolutely no doubt that when it comes to access to testing, things have improved. We know that from the number of laboratories we have. We know that from the number of sample collection sites. Even yesterday, we put out the numbers for those sample collection sites. So sample collection sites are not difficult to access. Yes, information is important. It's important for people to know where to go and test. But a lot of the facilities increasingly we are now introducing sample collection in some of the federal medical centers and teaching hospitals. Lagos certainly doesn't have a problem when it comes to access to testing because Lagos continues to test more than any other part of the country. If other states were testing at the rate that Lagos is, so Lagos and the FCT, at the moment, we have a target of 1% of the population being tested. That's our target. That's how we got the 2.1 million. Lagos has reached 50% of that target. FCT has reached 50% of that target. 7 of the local governments that I talk about, 7 of the 20, are in Lagos. So when it comes to access to testing, Lagos is not the problem. It's other parts of the country. And even with other parts of the country, it's actually the issue of information, knowing where to go and get that information. Even yesterday, we provided those telephone numbers. Even yesterday, we did make it clear that the state emergency operation centers are the key. But let me re-emphasize this again. When it comes to sample collection and access to testing, it's a state responsibility. The role of the PTF is to make sure that the states know that and also to help them to assist them when it comes to funding, which we have done recently because we've provided almost every state with 100 million, and there's an additional 1 billion that will be coming to each of the 32 states. Already the remaining 4 or 5 at funding. So you can take a horse to a river or whatever what they call, but you can't really force it to drink. Force it. People are not. The demand is very low. And that's where the risk communication and community engagement is essential.
So sometimes when we see these kind of problems, we need to always domesticate the solutions. So people won't ordinarily come forward. My question to you, sir, is how are you engaging this local government? Because it seems that they are almost lackadaisical to this issue of testing. They've moved on. Many of them seem to have moved on. So how do we domesticate the solution? Where do we begin to go door to door? Do we begin to ask people to go to the churches? Now that they're going to churches, should we go to churches and start testing people? What solutions can we provide to help the local government and the state to ensure that testing is done?
So it's not just about getting the message over. It's also about the messenger. So if I tell you that you need to test, you may not necessarily believe me. You may not necessarily go and have a test. But if it's your pastor, if it's your traditional ruler, if it's your community leader, you are more able to. You're probably going to be more convinced. So we are changing the message in addition to changing the messenger. And the message is, yes, if you get COVID now, the majority of people will be fine. But the issue is when a vulnerable person gets it, your loved one, your parents, your grandparents, people that you love, if they catch it, the risk of death is very high, up to 18% in Nigeria. Almost 1 in 5 will die if you're above the age of 65. The majority of those that have COVID in Nigeria are between the ages of 20 to 39. These are the very people that do not take care when it comes to non-pharmaceutical interventions. They don't wear face masks. They are the ones that are least likely to be symptomatic, and they are also the ones that are most likely to transmit. So we are working together with the traditional rulers, the Council of Religious Leaders, and also the state governments, working right down to the grassroots. We have over 18,000 volunteers in about 17 states. We've mobilized people from other parts of the health sector, including the polio structures, for instance, up in the north. We are also working through market women, through Association of Road Transport Workers, to push out that message, not only for testing, but also for wearing masks and ensuring that people have the message to be able to protect themselves.
All right, let me take this
But
call.
this is collective responsibility. It's not really just the PTF alone. As you said, this is a collective responsibility. It's all of us. If we test widely, today, if we go to a test to a state and we get the cooperation of the state government and we test, and there isn't any COVID, we'll open up.
Okay.
It's the fastest way of opening up.
Let me take this call for you. Good morning. Are you there?
Yeah, hello. Hi,
Thanks for
good
calling.
morning.
Good morning.
Yeah, please, I have a concern. I actually went to Yaba Isolation Center for testing last week, Tuesday. Okay, I had ear infection, which apparently went down to my throat. And it was really painful. So I didn't know, nobody is going to take me in the hospital. So I had to go and, do COVID test first.
Okay.
As I speak to you now, the test is not out. It's so sad that what if the pain was so bad that, it can even kill me. I still have to wait up until this time now, and the test is still not yet out. No one has called me from the facility. Nobody has told me anything. I can't go to the hospital to get evaluated. It's so sad.
Thank you very much.
Nima had that same problem.
Nima had that same experience. So that's like a local problem.
I wanted to build on it with him that, yes, you've given these states the funds that you mentioned. How are you making sure that, sample, what is it called? Whatever they need to take samples and test those samples are, bought and used. For instance, how many days should it take? How many tests can a person get before the person is certified free? Because I got the second test, and the third test, I never got a result. So they just went with the number of days and said, you're fine. So how many days do you need exactly? What are you doing to ensure that the NCDC or the centers in question, that the people working there are doing the right thing in partnering with the state, so that they're not just disposing funds without doing the right thing?
So the process of, so first of all, let me start with the earlier speaker, and of course, we're sorry to hear about you, the pain you've been having. The NCDC are currently piloting an electronic platform to enable people to access their results straight away after testing. So you don't even need to be called, etc. I know that there are elements of operational inefficiency relating to results. Because they usually prioritize positive results. So if you have a test and it's positive, they will prioritize phoning out and transmitting that information. But I do agree, a negative test is just as important as a positive test, especially for somebody who wants to access treatment. Although as a clinician, I would say if you have ear infection, COVID does not cause ear infection. So for any decent doctor, they should know that really these are not the symptoms of COVID, and you should have been given access to medical care straight away and treated. You really shouldn't have to wait for a COVID test in order to have access to treatment. So when it comes to the issue of repeat testing, we've made it very clear. With COVID, if you're positive, if today you get COVID, you do not need a clearance test. In other words, you do not need to have a repeat to make sure it's cleared. We follow the symptoms and also the duration. If you don't have any symptoms and you've had 14 days of isolation, full stop, that's it. You can come out into the community, because there are a lot of studies that have shown beyond 10 days, the virus is no longer viable.
Right.
And even if it is picked up on PCR, because PCR looks for the presence of viral nucleic acid, so that can persist in the nose, in the respiratory tract for a much longer period of
Right.
time. But the virus is not viable in itself.
Okay.
So you don't need a repeat PCR. If you get a repeat PCR, you could end up having a repeat PCR that's positive for weeks, and you still be tied down at home, etc.
All right.
Symptoms, if you don't have symptoms and you're well, after 14 days, you can go back to
Fantastic.
your normal
Let me go on a
normal
quick
life.
break, sir. We'll be right back. Thank you. Thanks for staying with us. So we still have the National Coordinator, Presidential Task Force on COVID-19, Dr. Sani Aliyu. Doctor, very quickly, I know we hear about a saliva-based test being approved in the U.S. because it's cheaper and faster. Is there any possibility for us to get this mode of testing in Nigeria as soon as possible?
So the NCDC has been validating a number of rapid test kits. The outcome of that will really determine whether or not we'll be using antigen antibody-based test kits. In the past, we haven't, because the performance of the test kit has been really suboptimal. And that's why a lot of countries don't either. PCR is far more sensitive. And if you're doing a screening, what you want is to be able to catch as many positives as you can. Whereas with the serological test kits, the sensitivity is about 60%. So in other words, if you have 10 cases that are positive, on average, the kit will pick up only 6, and you will have 4 that are reported as false negatives negative exactly when they should have been positive. But as I said, technology is moving very quickly, and we'll await the results of the validation of the various test kits by the NCDC, and then we'll take a decision.
Doctor, you mentioned earlier that, after 14 days, after a COVID test, and the person has isolated for that 14 days, the person is fine. You don't, so no need for retesting. But I went after 21 days of my initial test result, and I did another test, and it was still positive, even though the information, everything had been given. So what explains that?
Yes, so that's what I said earlier on. So PCR looks for the presence of viral nucleic acid. It doesn't look for the presence of a virus that is alive. For you to know whether the virus is alive or not, you need to put it on a culture medium. There have been studies that have shown repeatedly that after 14 days, provided you don't have any symptoms, after 14 days from having a positive PCR, you should be fine to stop self-isolating, because when they took samples from those patients and put them on a culture media, they did not grow. The virus was dead. It was dead nucleic acid, dead viral particles, but they will still come up positive on PCR, because PCR detects the presence of nucleic acid, DNA or RNA. It's an RNA virus. So, but it's not viable, and therefore it is not infectious. It's just like saying, okay, you're doing a test to detect the presence of dogs, for instance, and you have a test that can detect that there's a dog in the room, but it cannot detect whether or not the dog is alive. Okay, so that's a PCR test.
Right.
It can show that there's the presence of a dog, but not necessarily that the dog is alive.
Okay. Gotcha.
So that's what a PCR test is.
Final question for you, sir.
I was just going to ask why the PTF is not engaging in the power of advertising, because advertising is so key to enlightening people. And I'm not talking about going to the traditional rulers, where the traditional rulers are advertised there. The local governments, PTF should advertise there. If you advertise, the level of awareness in people will be huge. So I'm just asking why the PTF is not engaging in the power of advertising.
So we do NOI polls every week, and we poll at least 1,000 Nigerians within the country, and 1,000, we take a specific state and do 1,000 plus. And consistently, what our polls have shown is that people are aware of COVID. People are aware of COVID. More than 90% have had a radio jingle or seen a TV or seen some sort of mobilization at the grassroots level. The problem is not the knowledge. The problem is translating that knowledge to action. And when we ask them, how do you protect yourself? People know about face masks. People know about hand washing. But as I said, this is behavioral change. When it comes to COVID, we have invested in media and advertising more than possibly any other program for a long time. If you open up TV, you will hear about it, radio, the same thing. So advert is not the problem. It's really trying to convince people that they have a risk, and that perception of risk is understood by many, and people are able to take the decision to protect themselves. It goes far beyond just advert. But to me, it's actually more about engaging people through community leaders and people that they trust.
Right.
To tell them that, yes, COVID is real, and please change your behavior so that we can all get back to normal as quickly as possible.
Thank you very much. It's been a pleasure having you. We're speaking with the National Coordinator, Presidential Task Force on COVID-19, Dr. Sani Aliyu. It was a pleasure having you, sir. Thank you very much. Now, I know we have quite a bit of tweets. A lot of people have sent in messages on this. Obviously, from the very, very important question Waike asked, we thought advertising was a problem, but he's saying that people are aware. But because you're aware doesn't mean that you actually do what you're supposed to do. So it now goes back to the individual responsibility.
Look, let me give you an example. Let me give you an example. This lady tested positive over the weekend. We got Omotola. And so I was telling, because Omotola is a famous person, and so I was telling my girl, I was telling Salome, I said, Salome, Omotola tested positive. And I don't believe.
The same Salome I spoke to that,
that you spoke to. So it is only by constant, it's not that you will do advert for...
No, Salome will not believe it if he doesn't want to believe. You can't put it in her head. Obviously, she has made a decision not to believe. The point, what I'm hearing him saying is that you as a person must decide that, okay, this thing is real, and I'm going to take responsibility. The government can't force it on your head. You can't force it on your throat. Salome, no matter what you do, will still say it's not real because she has decided that it's not real.
No, she believes it's real, but she doesn't believe it is... A lot of them believe it is real. And that's what he said. People believe that, yes, the COVID is there, but that it will touch me.
There's a whole different...
So you have to... You see this thing? It is...
But I don't think advertising will solve that problem. That's what I think.
Remember I told you about the AIDS one in 1986. We did not have any... We had like 3 cases of AIDS in Nigeria. Today, we are epidemic status in Nigeria because there was no advertising.
Let's take a few tweets before you round on.
Mayawa says, my mother and her sister want to test for COVID-19 as my mom has been feeling some of the symptoms, but they don't even know where to test in Ilesha. I had to tell them to just approach any major government hospitals to make inquiries. Oluwakemi Sola says, the doctor should tell us where they conduct tests in Abuja. I think all the centers should be made public. And Andrew in StarTimes says, testing should be based on how South Korea did it. Every nation on earth are looking up to South Korea. It should be cheap, accurate, and quick. Then, comes the question, what are your microbiology labs of our universities doing to help?
Roberts.
Mikey, we're going to come back to this. Let me just take a quick break. I think I have Oluchi. Oluchi, are you there? We may have lost our call. Let's go on a quick break. We'll be right back. Thanks for staying with us. So we're going to wrap up on the issue of COVID. I know we had quite a bit of tweets. Mike, do you have some for us?
Yeah, Bilikus Mafe Fagbemi says, sadly, economic sustainability has taken priority over safety, and it isn't just Nigeria that's opening up the economy again. It's become a necessity, as we have been told COVID-19 will be here for a long time. We must learn to cohabit with it. Sad reality. God help us as we help ourselves. She also says, the reality is there is so much the government can do. There is no nation on earth that can afford to remain in lockdown for the rest of the year. We need to put safety and security measures in place, and citizens should comply for the sake of their own health and life.
Right. There's even this one she
has said it
all. She said random testing might not be effective if people still expose themselves to being infected after testing negative to the virus. I think the future should focus on vaccine, and precautions should be taken prior to that. Emphasis should be on prevention.
I totally agree with that tweet, because yes, there's one thing of testing, but emphasis should be on prevention, how to ensure you don't even get it at all.
So you are negative does not mean you're immune.
Well, the campaign Waike was talking about is that the publicity should be, what do you take to strengthen your immune system? How do you prevent yourself? How do you protect yourself? How do you ensure that you're constantly using sanitizers?
Since we opened,
because you've tested negative. Just so as she said.
Since we opened, we make sure everybody wear your mask. If you don't have a mask, we are selling masks. So wear your mask. We have the wash your hands, sanitizer, everything as you enter. I won't normally go to Shrine on a Sunday unless we are playing. I went there to make sure that everything was being complied with.
I was in Magodo yesterday, and somebody had passed on, and there was a party. But I know there wasn't a crowd outside. So I know there were cars, but there wasn't a crowd. I saw the tents, I heard music playing. In fact, it sounded like a band. I saw caterers going in and out, and I'm thinking to myself, Lagos and Sha and this party thing. But I'm sure they also complied. I'm sure they actually had face masks because there wasn't so many people. There weren't so many people there. But the important thing, life is going back to normal. But what's more important, you as a person must take full responsibility. Even if you attend a party, know the chair you're sitting on. Stay there. You can attend a party.
Don't attend a party.
When you attend the party, when you want to eat, must you not remove the mask?
You remove the mask just to eat now, and then put the mask back. You
By that time that you are eating, the person that has Koro will come and stand beside you and pass it to you.
Something funny happened at the bank yesterday. Something funny. So the person attending to me didn't want people close to her because she's afraid of COVID, and rightfully so. But there was a woman who had hearing impediment, and the woman would not have it. She could not hear her through the mask. She insisted. And she was right beside me screaming. I was just minding my own business. So a lot of things that we need to put in place that we're not doing diligently.
Unfortunately, that's all we can take on the COVID updates.
You can watch Your View on TVC every Monday to Friday, 9 a.m. to 10:30 a.m. Nigerian time on DSTV channel 418, GOTV channel 27 and channel 47, StarTimes channel 121 and channel 307, Play TV channel 801 and channel 190, UHF 49, Sky channel 515 for UK viewers. Watch live on Facebook at TVC Connect and on our website tvcentertainment.tv/livestream.